At Grady, we all have a responsibility to ensure the safety of the patients in our care. Part of this responsibility includes preventing patient elopement and falls. Patient elopement is when a high-risk patient leaves the care area unsupervised without our knowledge. Inpatients on a psychiatric involuntary hold and patients who don't have decision-making capacity are considered to be high risk. If you see a patient leaving the hospital wearing a green armband, tactfully approach and determine if they've been discharged. Call the health system administrator or the operator if you need help.
Call Crane. Call Crane.
Excuse me.
Yes?
I think you're supposed to be in your room.
I'm tired of sitting in there. I just wanted to stretch my legs.
Well, now that you've had a nice walk, let me help you find your room again. Would you like me to get you a newspaper to read to pass the time?
That would be great. Thank you.
Elopement is different from a walk-away or against medical advice, AMA, because in those cases, patients have decision-making capacity. It's also different from a leave of absence, which is a temporary leave given by a physician. Against medical advice, or AMA, refers to a patient who decides to leave the hospital after we've talked with them about their care and the risk of leaving. Inpatients are not allowed to leave their assigned patient care area except with Grady personnel or as part of a leave of absence. An inpatient could have a change of green code status during their admission if their licensed provider thinks it makes sense. If a high-risk patient has eloped, first call the hospital operator, who will announce a code green over the paging system. Next, contact public safety. Third, patient care staff should contact the patient's physician. If the patient is not found within 1 hour, patient care staff will notify the patient's family or designated contact person and ask if they've been contacted by the patient. Then, the Grady Health System Administrator will notify Grady Senior Leadership, Risk Management, and Public Affairs. Lastly, if the patient is not located after a diligent search, Public Safety will notify the Atlanta Police Department. If a patient who is not high risk is discovered missing, notify the unit nursing leader and Public Safety. Be ready to provide information like the first and last name, a physical description, and their last known location. Falls in hospitals are one of the leading causes of injury and injury-related deaths each year. Studies show that approximately 1 in 4 patients will experience a fall during their hospital stay. All Grady Health System staff are responsible for preventing and reporting falls. We use the Hester Davis Falls Risk Assessment to identify a patient's risk of falling. The Hester Davis Fall Risk Assessment is a clinical tool used to assess the fall risk of patients. While clinical staff directly perform this assessment, it is crucial that all staff members understand the results and participate in fall prevention efforts. The Hester Davis Fall Risk Assessment considers multiple patient-specific factors that contribute to fall risk. These factors are used to calculate a risk score, which helps the healthcare providers categorize patients as low, moderate, or high risk for falls. The results are crucial in guiding interventions and fall prevention strategies. Visual cues are an important part of fall prevention and help ensure that both clinical and non-clinical staff are aware of patients' fall risk status. These cues serve as constant reminders to stay alert and assist patients as needed. Patients at risk of falling will be given a yellow armband, and inpatients are given yellow non-skid socks. In addition to armbands and non-skid socks, fall risk signage should be placed outside patient rooms and other high-traffic areas. This signage indicates the patient's fall risk level, helping all staff, including non-clinical team members, to stay aware and take appropriate action. Creating a safe environment is critical in preventing falls. All staff members, clinical and non-clinical, should actively look for and address potential hazards. Clear pathways. Ensure hallways, patient rooms, and high-traffic areas are free of obstacles such as furniture, equipment, or clutter. Staff should report any hazards immediately. Proper lighting. Ensure adequate lighting in hallways. patient rooms, bathrooms, and stairwells. Non-slip flooring. Make sure floors are non-slip and report any wet or slippery surfaces right away. Accessible call bells. Ensure that patients can easily access their call buttons to request assistance when needed. If you notice that repairing equipment or furniture could help prevent falls, call facilities management. Floor spills can be reported to environmental services. And refer to Grady's Health System Fall Prevention Policy on GradyNet for additional information. Falls should be reported to the clinical staff personnel immediately so that they can do an injury assessment. For each patient that falls, the provider should also be notified, and a fall event report should be completed in the event reporting system. That report should be forwarded to the risk management department.